Hey you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I may teach on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, we're continuing with our antibiotics. We were doing some things with the ears, so now we're gonna keep on through. I figure let's work through antibiotics through each system to kind of see it on a knowledge and application basis. Okay, so all right, question number one. The nurse practitioner has diagnosed a patient with uncomplicated sinusitis. As they have attempted watchful waiting without any improvement, the nurse practitioner is planning to initiate antibiotic management. What is the best first line treatment at this time? Is it A, ciprofloxacin, B, Bactrim, C, augmentin, or D, erythromycin? Take a moment and tell me what you got in the comments, you guys. I don't know how I have two C's on here, but tell me what you got. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked in the question, right? So here the stem of the question states, what is the best first line treatment at this time? So multiple things. Best, first line, these are key terms that you want to pay attention to in stems of question, in the stem of the question, and then treatment. Y'all know I say if it asks you for the treatment, you need to run it back and see if they have provided you with the diagnosis, right? If they have not, then you need to run it back a step further and look at the assessment findings. Now, I know my steps sound like, girl, we know this. You don't have to go through all of this. But in the process of completing test questions, and you're thinking of all these things and it's all this fluff, I promise this is going to help you walk your way through. So, okay, they want treatment. Let me see if they told me what the diagnosis is. Okay, they didn't tell me. Let's walk a little bit further and see what's going on and let me go through my steps. Because if you study in the fashion that I tell you, assessment, diagnosis, evaluation, and treatment, you'll be able to pivot in any form, shape, form, or fashion that they may deliver these questions, okay? But in this situation, they're asking for a treatment and they have provided us with a diagnosis, right? So the nurse practitioner has diagnosed the patient with uncomplicated sinusitis. It lets us know they've done the watchful waiting period. The patient is back. They're still having these, complaints. So we want to move forward with antibiotic management. So what is the first line treatment for uncomplicated sinusitis, right? And your answer is C, augmentin. Augmentin guidelines show that that's the first line therapy. Now, also key is here, what is the best first line therapy? You can also use amoxicillin, but all guidelines show that augmentin is the top and the best, so that's what you're going to go with, okay? So the best first line therapy for the treatment of acute sinusitis that is uncomplicated is augmentin. And remember, augmentin is what? Amoxicillin plus clavulanic acid, okay? All right, question number two. The nurse practitioner was planning to initiate augmentin for the management of their patient's uncomplicated sinusitis diagnosis until the patient later mentioned an allergy to penicillin. Based on the patient's allergy, what is the best treatment at this time? Is it A, amoxicillin, B, C, erythromycin, or D, doxycycline? Take a moment and tell me what you got, you guys. All right, so here the stem of the question states, based on the patient's allergy, what is the best treatment at this time? All right, so two things in the stem. We know we're looking for a treatment, so we're going to see if they gave us a diagnosis or not, which they have, and we need to pay attention to the allergy, right? So The patient has uncomplicated sinusitis as a diagnosis. We just talked about this, that the treatment is augmentin as a first line therapy, but this patient has an allergy to penicillin. Augmentin has a penicillin component because it is amoxicillin and clavulanic acid, right? So we know we can't do that. We need to go to the next step. So I tell y'all, when you're studying it, don't just do this blanket review and say, all right, sinusitis, augmentin, boom, you're moving on. No, this is how you get tripped up. So yes, augmentin is first line therapy, but if they have penicillin allergy, what is the next step you do? And the answer is D, doxycycline. We go doxy if they have a penicillin allergy, okay? All right, and question number 3 for today. The patient returns to the office today febrile with complaints of worsening sinus pressure and an overall ill feeling. He was seen in the office 1 week ago and treated for acute sinusitis with doxycycline for 5 days. As the patient's symptoms have worsened, what treatment would be best at this time? Is it A, amoxicillin, B, levofloxacin, C, azithromycin, or D, Bactrim? Take a moment and tell me what you got. All right, so you guys, similar question here. As the patient's symptoms have worsened, what treatment would be best at this time? All right, so again, we're looking for treatment. So we know we're going to go back and see if the diagnosis has been provided, but also it lets us know that the patient's symptoms have worsened. So we know we need to maneuver differently because if it's worsened, whatever we were doing wasn't working, right? All right, so this patient comes into the office, they're febrile today, their symptoms are worsening. They were treated with acute sinusitis. We treated them with doxy because remember they had the penicillin allergy. So doxycycline was the treatment for 5 days. For uncomplicated acute sinusitis, you can treat them augmentin, doxy for 5 to 7 days. It is shown that you can give them the 5 day therapy and it's just as effective. Now, guidelines show if the initial treatment of antibiotic therapy does not, if it fails, just say that, if it fails after 7 days, or if the symptoms worsen after that 7 day period, then you want to go to that next line of therapy, right? So your best answer here is B, levofloxacin. When you have utilized your treatments and it has worsened, it has failed, your respiratory fluoroquinolones are your third line, okay? So remember, fluoroquinolones end in floxacin, and remember Brittany's brilliance to retain and remember your respiratory fluoroquinolones because there's a group of them. Like ciprofloxacin is not a respiratory fluoroquinolone; it is a fluoroquinolone, though, right? It ends in floxacin. But your respiratory fluoroquinolones, I say, think get my lungs because we're trying to get your lungs together. There's something respiratory going on, right? So get my lungs. G for get, G for gemafloxacin, M for M for moxifloxacin, L for lungs, L for levofloxacin. Okay. So here, um, the best answer is B, levofloxacin. All right, you guys, I hope you found this helpful. We will continue our antibiotics. If you have stuff that you are struggling with and would like me to cover, please let me know. But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. And if you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. They're broken down by systems in the format that I teach in the assessment, diagnosis, evaluation, and treatment. If you are someone who prefers to study on your own, watching videos and utilizing it on the go, I do have a self-paced review course designed for family and adult Gero, designed for both exams, ANCC as well as AANP. That's also linked in the bio of this channel. If you're looking to test your knowledge and do practice questions, I have QBank options. You can have mini quizzes that you can study along with, doing 10 questions per quiz. And then the rationales are in video format like this, so I can help you study along with it so you can kind of tie things together. And then there's 2 practice exam, full exam. So once you kind of studied and gotten your flow and things, you can test your knowledge in a full test format. Okay. All of those are linked in the bio of this channel also. And then lastly, my one-on-one sessions. I always say reach out to us if you're looking to book a one-on-one session. because they are customized and we need to speak with you to gauge what you truly need. So the options that I offer, you can book a session to cover weaknesses, so 1 to 2 weaknesses per session. You can book an exam readiness assessment. You can book sessions to do question analysis, like so work through questions together, or customized plans. So the customized package is typically over a longer term. So saying that you want to do 2 weeks, 3 weeks, 4 weeks, etc., it's customized in that fashion. So if you would like to utilize any of those, feel free to reach out to us. I will be happy to work with you guys. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.